Hello, friends. Today again we are here post Diwali, and in this session we are going to present two cases which have been approached through different approaches. So, we all have cases where we don't get expected results. And in such situations, what do we do? What knowledges come in hand? How do we approach those cases? And especially if you have tried many remedies and not got the response which you expected. So we will see how Aditi has tackled this problem and we will learn from it. Welcome, Aditi. You can start your case.
Thank you, Anita. This is a case of a 76-year-old lady, and I had taken this case on telephone only because that was a peak COVID time. And so basically I have never seen her. It is the case has been only taken over the telephone. And so this case is about the palmoplantar psoriasis, and she said that I have a lot of deep cracks in the feet since last 2 years, and now it has become very very difficult to walk. And she said that I had shown it to someone, but he said that we will put the needle and we will remove the bad blood, and so I couldn't trust him, and I didn't go to him again. I just can't walk. There is a severe itching, and it gets aggravated at night. There is no pus or no blood coming out, but I can't even wear footwear. It is so sensitive. And now it's come in the palm also since last 1 to 2 months. And itching all over the body also I have started getting. And I am getting itching in the scalp also. And associated complaints were right knee pain, lower backache, and bilious headaches were there. But her focus was mainly her the skin complaints, and it was very very severe. Um, and she just couldn't walk at all. She was living alone in the house, and she had to totally depend on neighbors for the smallest of the work. So I asked her, so what's the concern? What is your main concern regarding this illness? How does it bother you? So she said, will this be cured? She's laughing and talking. Throughout, I had noticed that she's very lively, and she was talking quite laughingly, and I had never met her before. She has been some relative of my some family member, so I had never met her before. And still, there was very friendly way of talking. A 76-year-old lady talking to you, don't feel like that. And she said, you see, I am living alone now. So will this be cured? And then I was just going with the flow, and I was just letting her talk, whatever she is. And I would in between, I will just put a small question. And gathered all these informations. I am very jovial. I don't take stress at all. If you worry, then you get a heart attack. And she laughs again. In my life there always has been lot of struggle and hardship, and my life will be like this only. I till the end my life is going to be like this only. That's what she meant to say. And she had undergone lot of struggle in her life. She had lost her husband very young age, then she raised her children single handedly. And then her son also, a very young son, passed away due to CA liver 3 years back. Then his wife also had left after he passed away. She left her, and she went away to live with somebody else. So, and lot of other miseries also in her life. She said, I'm a very strong person. My neighbors also don't come to know about my troubles. Generally, I'm not an angry kind of a person. There is no quarrels, no fights, not much fights and all. And I noticed another thing in her was that she follows all the instructions of the medicines very properly. So basically, through the history, I was getting only this much: very communicative, very intelligent, and very spirited person, and talking very sense and all. Though she is from a very small town, from a Gujarat, but her understanding of the life and life understanding, of course anybody can have, but the way she understood the modern things also, that was quite amazing. And she would follow all the instructions of the medicines very well, because I had changed few medicines, and I had given her water doses also. And on just water doses on phone also, she was understanding it so cleverly and so clearly, just in one go. Though, and she is not even, she cannot even read and write in spite of that. And when she was giving me follow up normally, and then she started talking about some her granddaughter's some problem, and in her marriage, and instantly her voice became very low and soft, as if no one else should hear about it. So there were this very sharp and alertness I could notice in her during the case taking and follow ups also. And for every follow up, her repeated question would be, when it will be all gone, when it will be all right. What do you think? You saw the pictures. Every time her neighbor would send me the pictures of her soles and palms, and from there, and then after talking to her, I would keep changing the medicines. If I ask her, how are you feeling? She will ask me, what do you think about my improvement? आपको देख के क्या लग रहा है? You know, that way. And she never lost courtesy once also while talking, though I could not give her good results for a good period of time. In spite of that, I never saw losing courtesy in her talking, always smiling, always laughing. So this was the case. And why the slide shows. Why this slides stops running?
Click on the screen and then go to again down screen.
Okay. So for this patient, my analysis was the patient is very talkative, jovial, laughing, very high spirited, very polite, courageous, curious, always inquiring about how much time it will take, and even some other things, COVID and some other news and all. She will keep asking me questions, and wanted to know so many things. Very communicative yet secretive, and very righteous, because while talking also, once or twice some references came about her, some lawsuits and all. And she would, the way she would present her thoughts about it, so like she was at this age also, like she said, you can't leave your rights, you have to fight for it. So that also I could see and observe in her, that trait as well. And yeah, so remedies like hydrocotyl, spongia, phosphorus, lacasis, they were given on the mind basis, on the taking certain rubrics, on understanding her personality through phone. I gave her all these medicines, but without any relief. Then with her communicative nature and all other features and skin complaints, I gave her sulfur. Sulfur did show improvement in her. So I continued with water doses, but after some time it failed to give any substantial relief, and the skin symptoms also again started recurring in a very short time. And then I gave a very physical prescription of petroleum, seeing the cracks and deeper cracks and bloody cracks, though there was no blood coming out, but the cracks looks were bloody, but that also failed to yield any kind of result. So like I was really thinking that how do I help this old lady, this patient of mine. And she could not walk all this time, only except when sulfur was given, little bit relief was there, but that also proved very short timed. So then I was thinking, and then I changed my approach, and I gave her medicine only on the presentation, and the skin eruptions which proved, and then that medicine proved very simillimum to her case, and then that thing cured her completely. That medicine cured her ailments completely and freed her from all the painful incapacitating lesions. And the medicine given was Malandrinum. Malandrinum 200 I gave her. Initially, I gave her once a week for 4 weeks, and then I followed it up with once in 2 weeks, and then once in 1 month, and the lesions completely went off. I will the next slides will show the results. I have few pictures of hers. And my base of my prescription of Malandrinum was the dry crusty eruptions, thick layer of crusts, and they then deep raggeds and bloody raggeds, eczema, palms and soles, itching, and so these were the on this basis I had given her Malandrinum, lot of itching and cracks. Malandrinum is actually very much known for ill effects of vaccination, but in this case I couldn't get any history of vaccination or anything, but generally we prescribe Malandrinum on this basis. So Malandrinum is a very good remedy for this. I will just show you the before and after pictures. See these so much of swelling of the foot. Both the feet were swollen, and lot of these blackish discolorations and kind of lichen kind of patches, but these were not lichen. This was all part of psoriasis only. And so these are the before the treatment, and this is after Malandrinum. We can see the changes. See, these are the deep raggeds, and these were the cracks. Deep cracks were there, like this everywhere. And see, these are the cracks, and these look at the lesions, the thick crusts, the kind of thick crusts, and see around the nails and everywhere. The lesions were so bad, it was just impossible for her to keep the foot down on the ground and walk. And see, this is after Malandrinum. These were her hands. It was even difficult for her to hold the spoon and eat also. This was little bit improvement after sulfur, but then again it had become like this only. So and this is the clear, all the lesions cleared after Malandrinum. Yeah. So this is how, I thought that I thought of sharing this case on this platform, because the Malandrinum is not very routinely prescribed remedy, and once in a while, whenever it has been prescribed, more prescribed when there is a history of vaccination. But here I thought of prescribing this remedy purely on the lesions, the type of lesions and the look of the lesions, and and I got a wonderful result, and the patient got cured completely. Now it's been almost 2.5 years, and the patient is completely all right. There is no problem. So, and now I will just tell you a little bit about Malandrinum. Malandrinum is basically made from the grease of the horse. Now, grease is a kind of eczematous disease of the horse. Generally, horses get the disease, and this eczema oozes some kind of fluid, and from that, this Malandrinum is made. Like it is and these cows generally get this disease because the cows generally then graze on the field, and their udders touch these discharges from the horse's feet, and that is how the udders get infected, and that is how the cows get this disease, which is known as cowpox. And from there, the this discharge from that cowpox discharge, this Malandrinum medicine has been made, and so it is very useful medicine, and we all can think about it, this medicine, when we see that when we can directly use it and as a first go also from the experiences. And also, if your indicated medicines are not working and not yielding the kind of results we are looking for, then we can definitely think of Malandrinum at that time. Yeah. So anyone of you would like to add anything about Malandrinum? Then surely.
In your case, since you applied the mind symptoms also, but then it did not give result.
No,
Having such a getting a clarity of the local skin picture, it just cleared up the case.
Absolutely, absolutely. So this was a very different approach I had taken to solve this case. And many a times we have seen, we all have experienced this in our practice, that sometimes how much ever we are feeling that this is the right remedy, this is the simillimum, but somehow it is not working the way it should give the result, the way it should cure the case. And that is the time which calls for different approaches. And homeopathy, we have rich approach repertoires of the different approaches. So if we keep our mind open, we can ultimately help our patients through whichever approach we approach our case and get the simillimum. Yeah.
I invite Dr. Shobha to share her case also, which was solved with different approach. Shobha, can you share your case?
Yes. Yes, thank you, Anita. So this is again another case, like, which is called for a different type of approach than our regular routine approach. Now, this is again also a unique type of complaint, that this patient came with. The patient is a 14-year-old male patient who is studying in the 9th standard, and he was brought by his mother, and he is a very lean, thin, and short-statured boy. And the mother complained that this patient, her child, is having only 4 milk teeth of him have fallen down, and they are replaced by the permanent teeth till now. He's 14 years old and he's in 9th standard. So by this time, we expect all the permanent teeth to come up. But here, he has got only 4 permanent teeth till now. Only 4 are been replaced. And all are still the milk teeth. And now what happened is that since last 4 years, none of these milk teeth have fallen down. He already had some delay in the falling of the milk teeth. So mother waited for some time and she thought, okay, it will fall and it will come. So she waited till he was almost 12, because what had happened was that his first 2 milk teeth fell down when he was 8 years old. Then next 2 teeth fell when he was 10 years old. And from 10 years old, when he was 10, after that, the milk teeth falling down, it completely stopped. So mother waited, but when the child was 12, that time then the mother started visiting the dentists. So she visited nearly 4 to 5 dentists, including the orthodontists and the pediatric dental surgeon. But they all said that there is no treatment for it. because there were different things which were suggested. Some dentists said that, okay, now you extract out all these milk teeth, whatever are there, and once they are extracted out, then the permanent teeth which are there inside, maybe they will get a space and then they will descend down. Because now, because of the milk teeth being there, there is no space, and that is why they are not able to descend down. But there were another set of dentists, they said ki what if we extract out all the milk teeth, and after that, if the permanent teeth they do not descend down by themselves, what to do? Then we have to surgically open all the gums, and then with the orthodontist treatment we need to pull it down. So this mother was also quite anxious and confused that, like, what to do and what not. Like, if what if all this teeth are not they are extracted, and if the permanent teeth are not descended, so then what? Because her child is now already in 9th standard. It is just the 6 months remaining that he will enter into the 10th grade. And after that, he has to go to the college. And mother is feeling that, what will happen to her son? How can he attend the school when, like, without teeth being there? Will he not look, meaning it will look, how silly it will look. And like, mentally also he will get affected so much because of he not having all this teeth, and he has to go to the school and the college, and how will he feel? There will be a peer pressure also onto him. So then she went to her family doctor, and family doctor also gave some supplements of calcium and multivitamins, but without any help. So that was the time she came to homeopathy. And she also complained of, the child also had the complaints of nocturnal enuresis. But this was a very unique complaint, which she said. At the same time, what mother had observed is that since last 4 years, that since his teeth have stopped falling down, since that time she has seen that there is no much growth of the child also. Now we saw that this is the growing period of the child, and usually we see that they get a very good growth, because this is also a time period when there are hormonal changes which happens in the boys as well as the girls, and the puberty time, and there are secondary sexual characters develop, and there is a good growth at that time in this age usually. But then mother felt that she did not find that much change in the patient in last 4 years. The patient's voice is still thin and girlish. There are no secondary sexual characters developed. The puberty seems to be delayed. And she also said that, everyone in the family is usually having almost the normal height and body. Because many dentists asked her, is it that you have a family history of, having a short stature and all, like that is why the child is not growing or what? But she said that was also not the case. So in that case, if when I tried to inquire a little more about this patient's mental state, so mother said that when he was small, he was very sweet and approachable baby. But because of his short and stunted growth, what happened, and the nocturnal enuresis, what happened is he has become very shy and timid, and he's very over anxious while going in a crowd. He starts getting rumbling in the abdomen, and he prefers staying alone at home, but he won't go out to functions. And if he is bullied by the other kids or he is hit by the other kids, he will bear that hitting. He will come home crying. He will complain to mom, but he can't give them back because of his timidity. So he avoids going to the groups of the friends or to attend some functions and all. And when I observed the child also in the clinic, what happened was that the observation was that he seemed very timid and meek and shy type of person. He was very slow and a thin voice he had. He was sitting also with, like, drooping posture, like which showed that he lacked confidence, and he looked like a childish look was there. He was not grown as per his mental and physical age. That is what I felt. And he also seemed like dependent on mother. So with this, when I started understanding this case, I felt now what is coming up is what is characteristic in the case. Now, how to prescribe and what to do and what is exactly the problem in the case. See, to prescribe, if we understand the exact problem in the case, then we come very much nearer to solving the case. So when I thought the child who was born in a full term, he had little slow milestones, but not a major problem. But why he suddenly stopped growing? Because the way mother is saying, since last 4 years, there is no much growth which she's been able to see in the child. So I was not getting, or when I inquired with the mother also, she also could not understand, or she could not tell about any particular incidents or anything which had happened or which she could understand and she could narrate and tell us. So, but something had definitely happened due to which the patient's hormones decided to stop functioning normally. And the milk teeth, they stopped falling and the permanent teeth stopped descending. So the puberty also got delayed with secondary sexual correctives not developed. So we need to a remedy which can remove this obstruction to growth of the hormone. And his mental state was as a result of his disorder, because of him, that thing, he was very much timid. So a loving and an approaching child had become withdrawn, shy, timid, anxious and nervous, and a loner child lacking self-confidence. So we need a remedy which can take care of his arrested growth. From this thinking process, I thought of about the remedy Thyroidinum. I took the references and what I came to was Thyroidinum. Now, what was described in the Boric about the Thyroidinum is that Thyroidinum is a remedy to be considered in case of arrested development in children and having regulatory influence on the mechanism of the organs of nutrition, growth, and development. Enuresis is in weakly children who are nervous and irritable. Effective in undescended testicles in boys. We have seen this very commonly, that it has been prescribed in undescended testes. In our patient, in my patient, this case, patient had undescended teeth. He didn't have undescended testes, but he had undescended teeth. And somehow I found that there is some similarity. And the rubrics also wise also, when I saw that the rubrics which were covering thyroidinum were cretinism, childish behavior, despair of recovery, indifference and apathetic behavior, apathy to everything, complaints in children, dwarfishness, emaciation in children, and growth affected disorders of. So I thought about, okay, now for me, thyroidinum was a proper match to this case. And I gave him first dose of thyroidinum, single dose, and the teeth, which had stopped falling in last 4 years, in the first week of giving the first dose of thyroidinum itself, the patient tooth started shaking. And in the next week, the tooth fell off. One tooth fell off. And even the new tooth erupted very fast. The permanent tooth came up very fast and very smoothly without giving any difficulty to the patient. And in the span of next 6 months of the homeopathic treatment, I gave him totally 3 doses of thyroidinum 200 and 2 doses of thyroidinum 1M. And patient's 4 milk teeth fell off and all were replaced by permanent teeth very soft, smoothly. And his face and the jaw also grew a little wider to accommodate this permanent teeth. And he gained 5 kgs of weight and his height also increased by 7 inches. So patient's nocturnal enuresis also stopped in the first week of treatment itself. His hair disorder, whatever was there, he himself started feeling more confident. And that is how I felt that thyroidinum helped this patient both the physically as well as mentally. And after that, then when I came to know about, then after that, mother met me after a few months after that. And she told that, not few months, after few years. And she told that child was doing so well. He did his CA. He had given his CA exams. Finally, he cleared his CA and he's become a CA. And that is how wonderful, the homeopathic simillimum can act when it can act at some particular level. So I felt here also this case demanded some different type of approach because his complaints were very unique, and we had to really understand what was the exact definition, the problem of this patient. When we understand the exact problem definition, we can go to resolve the problem in that way, and we can help the patient homeopathically. So that is what was the approach taken in this case. Yeah, Kushala, do you want to say anything?
Yeah, I felt you both had given, two different dimensions in your cases. While in your case, Dr. Shobha, you understood that there was a obstruction at the physiologic level. The
Right.
normal growth hormone, which helps in development of the child, in the growth of the child, in his secondary sexual characteristic of this young child, was all obstructed. So at that level, you understood that where lies the problem. It was at the physiology that had to be initiated, and the block towards the growth hormone, which was not functioning, had to be removed. So that is very nice, and your understanding of thyroidinum, which helped to clear up the case. Well, in Dr. Aditi's case, she tried, in applying totality on the whole. But then when she failed, she understood that she looked at the skin very deeply, and she understood the skin, and she understood Malandrinum, and that's what which helped to clear up the case. So these were very good approaches where we are doing a little out of box, or we are being open, that we need not just have set parameters, but when things don't go the normal way, we need to do an out of box thinking and uh, cure the patient or give the patient relief. And that's the physician's high and only mission, to cure the patient, to heal the sick.
Yes, very true.
Yeah. If anyone else would like to share.
Anyone wants to add? Anita, do you want to add anything?
No, I was just reminded of Dr. Shankaran, who has given in his book Trinity of Homeopathy, where he tells that there can be different approaches, there can be different simillimums in one case. So, at what level you try to match, you will get response accordingly. So, if it was, a single simillimum, then results would have been so few. So, it is because of, matching at different levels that there is some impact of the remedy at least, and that is why we get good results even if we prescribe on keynotes or on miasm or on pathology or on whatever indication. So that is how the homeopathy has survived and flourished. So there can be different approaches that, and if we take up only one approach, then in such cases we will definitely lose out.
That is what we need to be open about, that.
Yes, because not in all cases you will be able to judge the mind of the patient. Finally, it is a very subjective phenomena. So
the principle of homeopathy being unprejudiced observer.
Yes.
So we need to be open, remove our prejudices, and be open to understand the patients, the problem of the patient, and then approach the case with whatever suitable approach for that patient.
Yes, even Dr. Shankaran talks about it, that every patient can demand an individualistic approach.
Yes.
So that is why he created those 8 windows, and where you are covering everything. So you may approach a case through mind, you may approach a case through physicals or keynotes or anything, whatever stands out in that case. Now in Aditi's case, that's the look of those cracks, it was itself was very characteristic. And in your case, the complaints, they were only very characteristic. We have learned about delayed milestones, delayed dentition, delayed speech, delayed walking, but delayed secondary dentition, the complaint itself is little different, and along with stunted growth, where thyroidinum comes up, and application of undescended testes and undescended teeth. So people can laugh at it, but then finally both are milestones. So we can generalize that the milestones are delayed. Descending of testes is also a milestone, and descending of secondary teeth is also a milestone. So you can generalize at that level.
Yeah. Okay, so
Yes.
on this note, we end up today's lecture.
Yeah.
Today's
Thank
session.
you.
Yeah. So, friends, I hope you will enjoy learning with us, and we would like to share as much as we can our cases, different approaches, different methodologies. So please do share, do subscribe, and thank you so much for watching.